1 in 3 American adults has high blood pressure, but only half those 68 million people have the condition under control. Hypertension is called the silent killer for a reason. Problems related to high blood pressure contribute to nearly 1,000 deaths every day. Doug Johnson looks at a nationwide effort called Measure Up, Pressure Down that is trying to change that.
There's a lot of talk about high blood pressure, but according to doctors, not enough activity. Medical professionals say hypertension is one of the main reasons people wind up in doctors' offices.
High blood pressure costs our country about $156 billion a year. And half of the people that have high blood pressure are not under control.
Dr. Mark Castelaw of BMG, the medical group, is part of a 3-year national campaign created by the American Medical Group Association's foundation called Measure Up, Pressure Down. It's an effort to help save many of the 1,000 lives lost every day caused in part by high blood pressure.
Well, cardiovascular disease is the #1 killer of both men and women in America. And if we can start shifting towards preventative measures, one of the key focuses would be on blood pressure.
The doctors and clinics that are part of the Baptist Medical Group are using the Measure Up, Pressure Down effort to raise people's awareness of their own blood pressure and help them work to control it when it's necessary. Uncontrolled high blood pressure damages blood vessels and can lead to serious damage to the kidneys, heart, and brain.
And your blood pressure can be up for a lot of different reasons, from blockages in arteries to a genetic problem called essential hypertension. There's some people that can eat properly, exercise, do everything just right, and their blood pressure is still high because it's a genetic anomaly. And those are the people that are at the highest risk to have some type of event due to the blood pressure because they're doing everything right, doing everything healthy, and they assume that everything is okay.
The goal of Measure Up, Pressure Down is not only to encourage people to know their blood pressure numbers, but to get 80% of patients with high blood pressure under control to a safer pressure by 2016. People all over the U.S. have high blood pressure, but those in this part of the country are at higher risk, in part because of lack of exercise and also because of diet.
We live in the South. Some of the best cooking in the entire world is here, fried chicken and barbecue. And having that occasionally is not a terrible thing to do. Having that every day is.
Another key to reducing the risk of high blood pressure also has to do with diet and how much salt you add to food. Reducing sodium, using less salt, helps reduce blood pressure. But some people will need medicines to help reduce their blood pressure more, which presents another problem. If they stop taking medication because they don't notice a change in how they feel, that's a risky move that can allow blood pressure to return to dangerous levels.
We're trying to prevent kidney damage, we're trying to prevent heart damage, we're trying to prevent you from having a stroke.
So, take the time to find out what your pressure is. Measure up. Then work with your doctor to get it under control and keep your pressure down. For Smart Medicine, I'm Doug Johnson.